Magnus, you do something called Mohs surgery. Could you tell me a little bit about that?
So Mohs surgery is a method for removing skin cancers. It's mainly used on the face, and it allows us to remove the skin cancer with a very narrow margin, but to be very confident that it's been fully removed. And the potential advantages of that really are that you end up with a smaller scar, and you have a higher degree of certainty that the skin cancer won't come back in the future.
Can you just go to anyone to get Mohs surgery, or is it a special?
It is a specialised procedure. So a dermatologist who would perform Mohs surgery would have undergone additional training, usually a minimum of a year fellowship, where you're exposed to a large number of cases which you perform under with increasing degree of responsibility, initially under supervision, and then at the end of the fellowship on your own, and you then of course continue to gain further experience as a consultant working independently. And it's like any technical procedure that to gain experience and confidence, you need to be doing a lot of the procedure, and you need to be doing it in a setting whereby you've got other colleagues who are doing the same thing, and you have an interaction and a dialogue about challenging cases. Patient will come up to the operating facility. The beginning of the procedure under local anaesthetic would remove the skin cancer with a very narrow margin, and then rather than sewing it up directly, what we would do is put a dressing on. And then the patient will go back to the waiting room, and in fact they'll be then waiting for up to 1 or 2 hours whilst a technician prepares microscope slides. I will then read the microscope slides, and on average I'll need to go back at least another 1 or 2 times, millimetre by millimetre, tracing out the roots of the skin cancer until it's all fully removed. At the end of the procedure there'll be a hole which I will need to repair, and the best way to repair it will really depend on where it is on the face, the size and depth of the hole, and I would discuss the different options with you at the time. It could range from sewing it up directly as a straight line through to more complicated procedures such as skin graft, which is where we take skin from somewhere else on the face, or a skin flap, which is essentially where we make a longer cut to slide in skin from nearby. So you can potentially end up with a longer scar, but with the goal of giving you a better cosmetic outcome.